HealthSocio, where we take a holistic approach to what contributes to human health, quantify them, and link it to the medical record for a broader view of health. Let's quickly try to understand the social determinants of health.
Determinants of health. This is a very important concept to understand because its impact on the health of individuals and of populations. Health is quite variable, not just between individuals, but also across different population groups. Let's take an example. In 2015, the life expectancy of a child born in Sierra Leone was 50 years, whereas in Australia it was 83 years, a difference of 33 years. But there are differences even within countries. For example, in Australia, the life expectancy of Indigenous people is about 10 years lower than that of non-Indigenous people. Within a population, health is also influenced by social status. People with higher income, a higher level of education, and a better occupation have better health and a greater life expectancy. Health status can change as well. For example, studies of migrants have shown that the type of diseases, health behaviors, and risk factors are different in migrants. A person's health is influenced by a range of factors called determinants of health. These include who they are, individual factors such as age, sex, and genetic makeup, and also what they do. This includes their health behaviors such as smoking, physical activity, alcohol use, and diet. Health is also largely influenced by the conditions in which people are born, grow, live, work, and age. These include their social and community networks, the socioeconomic, cultural, and environmental conditions that people live in, and also health systems. These are collectively called the social determinants of health. The social determinants of health are ultimately shaped by the distribution of money, power, and resources at an international, national, and local level. They have a marked influence on health inequities, which is the unfair and avoidable health differences between different groups of people within countries or between countries. The socioeconomic position in turn affects the intermediary determinants of health. These include material circumstances, like the quality of housing, the financial means to buy healthy food, clothing, or other requirements for healthy living, and also the work environment. Psychosocial circumstances, like stressful living circumstances, relationships, and social support. Behavioral and biological circumstances. In addition to these, health systems have an impact on the type and quality of healthcare available to people. It also determines how easy it is for people to access health services and receive the healthcare they need. Addressing the social determinants of health is not an easy task. It involves identifying the structural and
intermediate determinants of health and taking appropriate actions to improve them.
It is estimated that only 20% of clinical and medical care attributes to a person's health, and 80% comes from non-clinical factors, including social, economical, environment, and behavioral elements. But yet, there is a problem. Though it seems obvious, there is no real way to capture, quantify, and make it actionable at the point of care to give an overall holistic assessment of the individual and the health situations they are in. It could be that they are in an unsecure employment. It could be a migrant labor situation that is causing them a lot of stress. There are other kinds of insecurities. The Siren Compendium basically identifies 19 domains, and HealthSocio is basically working on defining these, find effective methods of multimodal engagement and assessing them. Relatable to actions is what we convert them, and we are linking them to medical records and measure the impact of interventions for cross-industry outcomes. The components include questionnaires, the multimodal engagement. They are automatically turned into ICD diagnostics. Going forward, these ICD diagnostics will be important in the HL7 fire standards so that they can actually be connected to the medical records for both individual health and population health. This is the architectural area of HealthSocio, where HealthSocio basically works with a point of care across the continuum to understand wherever the early point of access is, to run these questionnaires and automatically quantify them and codify them into ICD-10 medical codes that are then made available as FHIR standard APIs and linking them to the care context defined in the NDH. The HealthSocio platform, based on the trigger conditions for gathering the social determinants data, say for example for an ID in the NDHM sandbox, in this case, engages with with the member in their delivery mode preference, be it portals or their popular chatbots, and offers the consent request for the assessment and the questionnaire behind the assessment as well for the purpose of social determinants for a duration of, say, let's say 1 year. And the member can go ahead and answer these questions. And once they submit, the platform uses the Z code definitions that are emerging and converts the assessment responses into appropriate ICD-10 Z codes and stores it in a social document in that FHIR format. Once the social document is available, based on the member consent, that information can be linked to the medical record for that health ID, and the care context details can be updated for the HIO ID who had initiated and asked for this information. HealthSocio platform will be serving participants in the platform, including insurance companies looking for lowering the cost by introducing potential interventions on the wellness side, drug companies looking for people to extend their drug discount programs, government planning purposes. We will be working closely with organizations such as HL7 International, FICCI for Health Insurance, and Rotary bodies in India. Thank you.